Good afternoon. Welcome to the Black Women Lawyers Association of Michigan presents our mental health checkup with Dr. Sheree Johnson. We want to welcome you again this Saturday and encourage you to participate and ask Dr. Johnson some questions. Dr. Johnson, can you introduce yourself?
I can. Hello, everyone. I am Sheree Johnson. I am the director of the and founder of the Gestalt Institute in Ann Arbor, Michigan. Been in practice for a number of years. Uh, Opened up my office here in 2003. So my expertise has evolved around domestic violence and serving people who have anxiety and depression, and also training other young therapists to be Gestalt therapists. And I'm very happy to be here.
Thank you so much, Dr. Johnson. I'm going to depart and leave you to be able to answer the questions that are being presented to you. Thank you again for participating in this mental health checkup with us. Here's your first question.
What does it mean to have a mental illness? Okay, that's a powerful question and it's very broad, so try to make my response as brief as possible. When you are diagnosed with some mental health illness or disorder, basically what your practitioner is announcing to you is that there is something wrong with the brain itself. The organ itself has become sick, just like any other part of your body can become sick. So the heart sometimes becomes weak or debilitated, lungs, kidneys, eyes. So when I say to you, I am diagnosing you with this mental health illness, it is specifically about symptoms that are showing up in your behavioral or emotional responses that are indicating something in the brain has become imbalanced. And this is a very different definition from maybe 20, 30, 40, 50 years ago when someone would announce or say, I have a mental health illness. We would assume then that there was something just behaviorally or emotionally wrong with the person. It's not been until this last century that we've been able to link mental health issues like depression and anxiety with actual neurobiological issues that show up in their brain. Okay, so that's my definition of mental health illness. What causes mental health illness? Well, currently, what we're finding using MRI scans and also some tests that we can run either through clinical assessment or through some sort of lab report is that there can be a lot of biochemical issues that go on, either genetically predispositions or from lifestyle or from the term that we use called chronic stress. And I can talk a little bit more about chronic stress, which seems to be the primary source of many of the mental health disorders that I see in my practice. So some of the external causes of mental health issues will present themselves like sexual abuse or some sort of trauma, physical abuse, chronic stress due to lack of resources, poverty, racism, sexism, any of the isms can contribute to a perceived or actual experience of being threatened, which creates various forms and intensities of another disorder that we call PTSD, post-traumatic stress disorder. What are some of the warning signs of mental health illness? Some of the warning signs will show up either physically. You might have an increase in heart palpitations, blood pressure goes up. You might lose your appetite or overeat. You might sleep too little or too much. Some of the cognitive signs that show up are rigid thinking or fearful thinking. These are people that generally are diagnosed with some sort of anxiety disorder. Feeling pessimistic all the time. So those are some of the thoughts that people can continually be plagued with that indicate mental health disorder. What should I do if I know someone who appears to have the symptoms of a mental disorder? What should I do if I know someone appears to have symptoms of a mental disorder? Well, what I would advise anyone to do who is concerned about a friend or loved one that they believe has some sort of psychiatric issue suffering, plaguing them, is to talk to the person honestly and openly about what you see that is different from what you've experienced as being the norm, and try as much as possible to help that person make a self-assessment. Because I think the wrong approach is to tell someone that you have a mental disorder, but to suggest to the person that, I've experienced you this way, and now I see you doing or behaving or thinking or feeling this way, gives an opportunity for an authentic conversation to happen. What treatment options are available? Well, treatment takes many forms. The first step, of course, is, if possible, is to get into a mental health professional and get some sort of diagnosis so that you understand what you're working with. Symptoms come in clusters. Not all symptoms represent all kinds of disorders. There's a lot of crossover in mental health. And then some symptoms are simply transitory. They may not be a part of that person's overall being. They could be a response to, as we're seeing in our current situation, some immediate and real threat that's causing people to have a response. It is natural for the body to react in stressful response way in order to protect itself. So there may be just an opportunity, if we feel that someone has crossed a line or they're acting in ways that are threatening, or their chronicity is such that it's diminishing their lifestyle or their sense of happiness, then to help that person find some professional support. What are suggestions for people who are dealing with the loss of friends and family members? The way that we have dealt with grief in the past is that we had each other, physical contact, hearing a person's kind words and verbal support, or having that physical touch be a way that we could handle our grief. That's not the case now. And so, like many other professionals, I'm challenged to trying to help people understand what it is that they can do to deal with their enormous grief. My personal hope is that regardless of what culture or religion or spiritual practice or non-spiritual practice that an individual has, that you will find a way to connect to a source that gives you some sort of cope. So it could be prayer, it could be through meditation, it could be through just being quiet, it could be through going outside when you have an opportunity and just inhaling the air, allowing your visual senses to take in what scenery that you can, using your natural body's healing responses to help you go through the grief. The most important advice I will give you is to never suppress that grief. You can't drink it away. You can't get high and hope it'll go away. But sometimes tears, crying and wailing and getting on the knees are the best healing antidotes for that level of grief. What are some tips for people who are trying to cope with this global pandemic? My number one tip is this: take your news in small doses. What I've noticed is that people who have metered the amount of time they spend on the internet scanning the news and trying to understand the statistics and the conflictual reports that we get, and all the conflictual advice that we get, tend to be a lot more stressed out or prone to anxiety than people who don't. So if you're going to look at the news, try to minimize the amount of intake, because all of that produces excess cortisol and stress hormones in the body that will eventually affect you physically. Definitely will affect you cognitively. The second thing is to try to move as much as possible. Movement is a natural healing technique. Breathing is a natural healing technique. Using the visual senses, as I expressed earlier, in other ways than watching TV or watching the news or listening to the news. Just sitting and maybe, looking at a bird and trying to practice emptying the mind. These are all things that are going to help. I can't sleep right since this pandemic. What should I do? My mind is just racing. The best antidote for a racing mind is to train the mind to empty itself. And what that would look like is that you go into a quiet space using your breath and your attention. You train your mind to stay right in this very moment. Because right now, in this very moment, you are safe. Right now, in this second, you are safe. And when we can train the mind to slow down, experience the reality that is immediate, redirect it from the beliefs that take it into a future experience of terror, we will experience immediate calm, an immediate sense of some control. And the reality is the only thing that is happening is whatever is happening right in this very moment. Because we are isolated and we don't have a chance often to meet as a group, going into a quiet space, making that your sacred place, learning to train the mind to be still, to be quiet, reconnect your mind to the now is what's going to help us through this pandemic. Should my depression be treated with medicine, psychotherapy, or both? The ideal is that you first get a diagnosis, because depression shows up in various intensities. You may not need medication at all. You actually may not need any psychotherapy other than someone to say, yeah, you have mild depression and these are some things that you can do. If your depression is such that it has become severe and your biosystem is totally out of whack, my suggestion is that people take a holistic approach. You go first to a psychotherapist or a psychologist, get a mental health diagnosis, and then that person will help you to decide whether or not you need to go further to get psychiatric treatment from a psychiatrist, or if some other plan of action will help you. Psychotherapy always helps because hopefully you get to sit with a person who is trained and experienced, who has some data in his or her background to give you experiences of others who have been in similar situations and what they did that seemed to be successful. You also get the opportunity of just having some non-judgmental support so that the two of you can work through a solution plan that will help you in your particular needs. What are your suggestions for Black people with health challenges to boost their immunity? My immediate thought was that we need to cut down on the amount of meat that we're eating. I think our diets need some reexamination. Our immune system is directly influenced by the type of food that we and drink that we put in it. Too much anything is going to compromise our immune system. So to recheck our eating habits, get rid of the sugar, the alcohol, the excess salt, all the things that we know we suffer from because we do it in excess. Too much pork, too much beef, not enough vegetables, not enough fruit, too much caffeine. All those things will contribute to a compromised immune system. It should be of no surprise that people of color are contracting this virus and are dying in unprecedented numbers. And it is for the reasons that I just pointed out. We don't eat properly, period. We do not eat properly. Second thing is that we have to move. We have to get from in front of the television or the computer or whatever it is that we're doing is making us sick. And we have to move. Current research is showing us that the best antidote for any kind of mental health issue, physical challenge, is aerobic exercise. Move. Could my depression be causing me physical pain? Absolutely. Depression has been linked to all kinds of muscular disorders. What I call these phantom or ghost pains that show up in your joints often can be rooted in depression. And remember, depression is not just a component of psychological dysfunction or depressive thoughts. It is also an indicator of an imbalance in your biosystem. And sometimes people who lack vitamin D, which is very common in people of color because of the melanin in our skin, vitamin D deficiency will often contribute to depression. Could other health conditions be contributing? Absolutely, I just said that. So there are some vitamin deficiencies and lack of physical activity. The heart is particularly an indicator of many of the symptoms of depression. Also, women who go through menopause, it's not uncommon to have depression because we are either postmenopausal or premenopausal. So there are a lot of other reasons besides psychological or behavioral, emotional issues that can contribute to stress. Why can't I get over this problem on my own? I think my simple answer or response to that is because you don't know how. If you knew how, you would have done it. This is why we have people called experts. I can't fix my car. I have to take it to the shop. If something went wrong in my apartment, had something to do with electricity or water, I have to call an expert or someone to come and fix it. So the same applies with our emotional and mental state of being. Same applies with our health. If there's something wrong, I don't understand what it is. Everything I've tried hasn't helped. Find a professional, find an expert. What are the differences between a psychiatrist and a psychologist? I asked that question probably 40 years ago when I was interning at a mental health facility. And the response I got was about $100,000. The real difference is this. A psychiatrist is a doctor, and his specialty is the brain and brain disorders. A psychologist is trained, like I have been trained, to understand psychological dysfunction, emotional impairment, and cognitive impairment. We also now, because the fields of psychology and medicine have crossed, we have also had the opportunity to learn concepts around neurobiology or neuroanatomy. So that helps put us in a position where we can see and understand the lens that the psychiatrist uses when he or she is making a diagnosis and then trying to come up with a treatment. The other difference is the psychiatrist, because he or she is a physician, has the authority and licensure to issue medication. Psychologists, for the most part, cannot unless they get some special training. I just had a baby and I'm constantly sad. What is this and how do I shake this? Okay, so that's not uncommon. The condition that this person would have is not particularly uncommon. It's postpartum depression, and it's often a result of the hormones in the body trying to find a way to get back to what its normal was. So everything in the biosystem is kind of tilted, and the person will feel that emotionally. Also, just the whole act of having a baby in and of itself is very stressful. So there are different kinds of stress. Not all of it is bad, and in fact, some of it is necessary for us to function. And some of it is quite healthy and can be joyful, like the birth of a baby. But the stress of caring for the baby has a whole nother connotation. So that will also contribute to depression. What will help when a woman has postpartum depression? All the same things that anybody who has depression can do, and that is first understand your condition, and then try to seek outside help, and then take a holistic approach and make sure that you're eating healthily, you're moving, you're finding some time to be by yourself, get your own space, have some quiet downtime from the baby, and know that it will pass. This is a temporary condition for the most part. What made you decide to become a psychotherapist and a certified alcohol and drug prevention specialist? That response is going to require me to share, be a little more vulnerable, so I can share the personal place I came from when that decision was made. I had a very difficult start in my young adulthood when I got married. And it was only through a lot of prayer and support that I got from women, all the older women who attended the church that I happened to attend, that got me through that period. And I think they carried me and supported me and just loved me unconditionally for about 10 years. And my family as well, but it was actually mostly through the church that I can identify finding the strength to continue on and to heal. So during that time period, I remember when I felt better, when I felt different, that I made a prayer that I wanted to be used. And I wanted to be a servant. And so it was at that particular point that I found myself in grad school eventually in positions of where I would develop programs and then take additional training that would prepare me to be a Gestalt therapist and then a health psychologist. So this has been pretty much a lifelong journey that has spanned over 40 years. 40 years, older than most of you. Okay, so what is Gestalt? Gestalt is a, excuse me, a therapeutic approach that sees all experience as being alive. And so we see relationships as having a life of itself, an essence. Every experience is some sort of, has a quality of having life. And therefore, these experiences or the relationships that we form have an innate capacity, a genius is what I call it, to know how to give us the very best of what it is that we need if we learn to trust the process. So Gestalt is a holistic, alive, dynamic interaction with reality that we then use as a psychotherapeutic modality. How do Black people begin to trust medicine today after the Tuskegee experiment in the Henrietta Lacks sabbatical, etc.? I can't say that all Black people don't trust medicine. I can tell you in my family, we're split right down the middle. There were 14, 11, 12, 13, 14 in my tribe. And we were all split straight down the middle, including myself and my father and some of my brothers and sisters, one sister in particularly. We are very much cautious. We're very cautious about traditional or conventional medicines. We tend to want to look for any kind of holistic approach if necessary, if it's there, and we would take that route first. But there are others in my family who don't mind, they trust the doctors explicitly and it works for them. So I think that it might be a stereotype that many of us do not trust traditional or conventional medicine. And that is understandable, but that fear is something that I think can be rounded out if the person understands that nowadays medicine and holistic approaches can work very well hand in hand and are often necessary, often very necessary. Are you taking new clients and are you doing virtual visits? Yes, I told Chandrika when we were talking, I've been doing virtual therapy for a number of years, probably 14, 15 years, because many of my clients, I call my clients students, are all over the world, or all over the United States. So this is not a new modality for me. I'm very comfortable with it. And yes, I do take new clients. So, can regularly eating a healthy, well-balanced, reducing intake, nutrient-dense diet help alleviate depression? Absolutely. Let me make sure you got all the components. Healthy, yes. Balanced, absolutely. Reduce meat, please do. If you're gonna eat it, try to make sure you get in a lot of salmon and organic poultry if that's what your choice is. Nutrient dense, absolutely. The more greens, the better. The more green stuff that we can put in our body, I'm talking about spinach or kale or, green beans, any of that. The more greens that we can get in our body, the better. Fruit also, but you want to get fruit that you have to chew. So apples are going to be, better for us to eat than, say, grapes. So make sure you get fruit that you have to use some teeth with. I I do not have insurance. Can I still see you? Absolutely. If you remember a little bit ago, I told you that this is my path. It's something that it's a spiritual journey for me, this being my work. And so I have never and will never discriminate against people because they don't have insurance. In fact, I don't like billing, so it works fine for me, to set people up on a sliding fee scale. If I feel better after taking medication, does this mean I am cured and can stop? Absolutely not. Absolutely not. You always make that kind of decision with your physician, with the prescribing psychiatrist. In fact, I am of the school that if I have people coming in messing around with their medications, I politely tell them to find somebody else. That is the most dangerous and foolish choice that a person can make. You cannot take yourself on or off medication without the guidance of a trained expert. So if a doctor puts you on it, you go back to the doctor, and then the doctor works through what you need to do if it's time for you to come off that medication. See, Black people got through slavery, Jim Crow, and continued implicit bias. We used to be so resilient, but our suicide rates up in our community, and how do we address this other epidemic? Yes, suicide and homicide rates have increased in our population. The issue of resiliency, I think, is something that plagues the entire culture in the United States. I don't think it's exclusive to people of color. We've become, what's the word? Complacent. We've become very complacent. And as painful and hard as this epidemic is, it is an opportunity for us to do a lot of self-reflection and reprioritize. What are the things that really matter? What really matters? Because that resiliency did not come by itself. It comes as a result of having healthy family ties, having some sort of strong spiritual practice, having some sense of interconnectivity with a group, coming from relationships, loving, kind, intimate relationships. That's how we become resilient. That's how children become resilient. So how do I maintain a positive headspace during this pandemic? So there are several things I've already mentioned. I'll just try to list them again. The main thing is to learn to train what we call that monkey mind, so that it's not all over the place. You do that through prayer and meditation. I have one young woman I work with who has anxiety disorder. She has taught herself and has figured out on her own that when she uses the rosary, her mind automatically calms down. Using the rosary is no different from praying to Jesus or praying to God or to Allah, or to praying to the skies, or to just being still, enjoying the silence. The point is that whatever avenue or technique you use to train the mind, it has to be something that you apply consistently and that you cognitively connect to your safe space. Because if you have a safe space in your head to go to, you won't be freaking out. If you don't have a safe space in your head to go to, you're going to freak out. It's just that simple. The primary source of any kind of sense of protectiveness and safety is going to come from your own mind. Train your mind to be still. Find techniques that will work for you. Yoga works, Tai Chi works, walking, any kind of aerobic exercises I've mentioned before, getting together with friends and family virtually, having a loving partner, having a dog or a pet or a cat. Pet therapy is huge if you have an animal that has been well trained. So all of these things will help. So that's our question. Is that my last question? Okay, yeah, that's my last question. I want to thank you all for inviting me and for attending to my responses. I've done the best that I can. I hope I have answered most of yours. I can be reached at 734-255-8848 if you have any other questions or comments or thoughts, or you just want to connect. My email address is Sheree Johnson, Sheree Johnson, PhD, all one word, at Gmail. So please reach out, and I wish you all the best and continue to go forward. We will survive this. There's no question in my mind. We will survive. Thank you.